A yeast infection is when you have discharge and itching and burning. You might have pain with sex or discomfort. And that happens because the yeast that's in the vagina is actually overgrown, and so there's more yeast than there normally is. It's actually really common and normal to have yeast in the vagina, but you can have too much yeast, which will then cause you symptoms that are painful or uncomfortable. So it's really common for women to have at least one yeast infection in their lifetime. A lot of times it's associated with like increased stress, or if you've been hanging out in a wet bathing suit at the beach. Some women in pregnancy are more likely to have yeast infections because of changes in their immune system. If you're getting them more than once a year, it's really important that you make an appointment with your provider, because it's not normal to be having yeast infections, multiple times a year. Common remedies for yeast infections. So usually when you're really uncomfortable, we often prescribe an antifungal medication to help relieve your symptoms. And then a lot of times there's supportive treatment as well that we can talk about. So taking a look at like your personal care products, your clothes, your detergents, talking about whether you use condoms or don't use condoms, looking at your diet, your stress level, all kinds of things. We often will also recommend probiotics for people who seem to be prone to yeast infections. So there's women's health specific probiotics that can be really good for women who tend to get a lot of yeast infections. What steps can you take to prevent future yeast infections? So one thing is 100% cotton underwear is really the way to go. I know lots of other underwear is super cute, but your vagina doesn't like it. Changing out of wet bathing suits quickly, trying to eat like a fresh whole foods diet, trying to limit the amount of sugar and like simple kind of carbs that can kind of lead some people to have more yeast infections. And that like when you're exercising, change out of your exercise clothes pretty quickly. And please, please, please do not douche. That's a terrible idea. That creates way more problems than solutions. And we do not recommend that really ever. So if you currently think you're suffering from a yeast infection, or you know that you have a history of recurrent yeast infections, I really encourage you to reach out to your provider. You can find our contact information on the womenshealthct.com website.